All right, so to begin, my name is Dr. David Kennedy. I'm the Assistant Vice President for Admissions here at A.T. Still University. And with me, I have Mikkel and Kyle. And they are students here at ATSU. So specifically with KCOM, Kirksville College of Osteopathic Medicine. So we are going to talk about Kirksville. We're going to talk about the school itself, how to get into medical school, some of the finer points in what you might want to look at, the curriculum and things like that. And then we'll end up talking about the specific program, the Still Scholars program, and how you all might get into that. We have two Still Scholars right here, so we will be able to tell you firsthand how that program works and how successful it is. So good, it sounds like we're all ready. So I'm not tech savvy, so please excuse my ignorance here. So can everybody see the screen? It says ATSU KCOM Still Scholars Program. If not, we are really...
No.
Okay, well, let me do this then. This thing that says screen share, I guess I got to do that.
Yep, there it looks like it's starting. There you go.
Okay, we can see it now. Thank you. Perfect. Make sure I'm on. Okay. So first of all, let me give you kind of a broad view of what we've got. A.T. Still University is made up of 6 different schools. We have campuses here in Missouri, obviously, and also in Arizona. So the founding school of osteopathic medicine is Kirksville College of Osteopathic Medicine. It's been around since 1892. We also have another DO school in Arizona. That's a newer one. It started in 2007. That's the School of Osteopathic Medicine in Arizona. Our virtual school is the College of Graduate Health Studies, which has a lot of master's and doctoral programs in more health management type programs. And then in Arizona, from whence I hail, we have a dental school. One of the first dental schools in Arizona is the Arizona School of Dentistry and Oral Health. And then our newest school is the Missouri School of Dentistry and Oral Health, right across the courtyard here. And then last but certainly not least, in Arizona, the Arizona School of Health Sciences has a number of other different health programs: PA, PT, occupational therapy, athletic training, and audiology. So just to give you an idea of what ATSU is all about. This is our mission statement. I'm not going to read it to you, but I think the idea basically is what ATSU is really dedicated to doing is educating people that are going to become competent health professionals. And we're going to educate them with the osteopathic heritage and holistic view in mind, with the focus being getting physicians in areas of need. So we really want to educate physicians to go to those areas where access is very, very difficult for a lot of people. So that's kind of what ATSU is all about on a grander scale. We started back in 1892 again from Andrew Taylor Still. He was a medical doctor and a DO, obviously, because he founded the profession. And basically he got into it. His 3 children had died, 2 from spinal meningitis and 1 from complications of pneumonia. His first wife died from complications of childbirth. So as a medical doctor, he's getting a little frustrated, and then he joined the Union Army and fought in the Civil War, and saw really how medicine was really lacking. It was either a LAPM or laudanum kind of medicine back then. So there really wasn't a lot he could do as a medical practitioner. So what he did is, after the war, he really surveyed the country on different kinds of healing arts. He looked at the Chinese, because they were building the railroads across the West. He studied with the Indians and their healing arts that they all used. He studied a lot more anatomy. He studied a lot more physiology and chemistry, and really put all of those pieces together and came up with this idea of osteopathy. And so in 1892, he came to Kirksville from Kansas because nobody knew what osteopathy was, and so they kicked him out of pretty much every other town. So the city of Kirksville really allowed him to do what he did best, and that was treat everybody in a very, very unusual way at the time. So it was about 1874, he was in Kirksville and treating people, and they started coming from all over the place. Even different countries, people would migrate just to see Dr. Still. And so finally what happened was his family basically told him, as he was getting up in years, you had better start teaching others about this art of osteopathy that you've developed. So that's when he started the American School of Osteopathy back in 1892. And if you've ever come to our campus, the original school is right here on campus. So as is his home. So it's kind of fun to see that. So what exactly is a DO? You guys want to take that? You want to give us your definition of a DO that we'll look at the student perspective here.
So what I've come to understand is that a DO is a fully practicing medical physician who also has the training and the ability to use osteopathic manipulative medicine. Host of techniques that maximize the body's potential for self-healing and self-regulation.
Yeah, so I like that Kyle emphasized the body's own self-healing and self-regulation because well, let me give you an example. The other day we saw simulated patients, which are basically actors that come in and we get to learn and go through physical exam, things like that. We have cases where, let's say, for example, somebody can't see. So not only do we examine their eyes and their mouth, throat, nose, and all these things that are normal, that you would be normally associated with a doctor going in to have them look you over, but we also make sure that their head, their skull, their musculature, that their neck and things like that aren't affecting their eyes, so they're not, because you can have all sorts of like headaches and things like that in your neck from tension in your head. It can cause you eye problems, things like that. So we really feel like we think outside the box and not just one size fits all. We really take the patient and their specific needs into account.
Excellent, thank you. What am I doing? Sorry, technical difficulties. Please stand by. What? Okay, let's do that. I don't know what this is doing now. There we go. All right. Moving on. All right. So again, we'll expound upon that a little bit. What is osteopathic manipulative treatment? It involves the use of hands. They can use the hands not only to diagnose, but to treat a patient for certain illnesses and somatic disorders is actually what it's called. So the osteopathic physician is pretty unique in his ability to use those manipulative treatments, as Kyle and Michaela said. They can do stretching, gentle pressure and resistance. They are all using this as a treatment method in lieu of others. So they can couple this with other treatment mechanisms, with pharmacy and maybe even surgical treatment methods, but they're going to try to do the most conservative first and then expound upon that if they need to from there. So the osteopath uses a holistic view of not only diagnosis but of treatment, and they're really going to try to do their treatment from a conservative angle as well. So we do have some similarities and differences between that and our allopathic brethren. The four-year program is similar in hours, in techniques, in studying, and so the basic science education that they're going to use is very similar in both genres. The national and state licensure exams, which these two are just about ready to study for, are studying for currently, so they can tell you the nightmare associated with that, are very, very similar. You can specialize in pretty much any area of medicine as a DO. So they practice together with medical doctors. There really isn't a whole lot of difference. In fact, I get a lot of feedback from people that say they didn't know what the difference was until they looked at their nameplate on their door and saw that there was a DO instead of an MD. But there are philosophical differences like we talked about. So what does make them different? DOs have a little bit stronger focus on preventative health care. Like we said, we're going to look at the body in a holistic manner, a little bit more conservative. So what can we do to prevent illness within the body? We approach the body as an integrated whole. So the body is not, the whole is not just the sum of its parts when it comes to the human body. It is very, very much, it is a lot more than that. So we use structural diagnosis, we, meaning these guys here, use structural diagnosis and those manipulative treatments in our overall health benefits for our patients. They're encouraging the natural tendency for the body. The body has a natural tendency to heal itself. That's one of the 4 tenets of osteopathy. So what we're doing, what they are doing as DOs, is enhancing that body's ability to treat itself, using the musculoskeletal system and all the smartness that they have, that they're gaining in school right now, and all the practice they're getting as they go through those OMT techniques. There's a lot of clinical assessment, clinical patient care that these guys are going through in school right now, because again, we want to develop, at ATSU, we want to develop competent clinical practitioners. Sure. Oh, do we have a question? So we do have a question. Yes, thanks, Kyle. Do MDs not focus on these things as well, looking at the body as a whole and focusing on preventative health care? You guys want to take that one?
So now they do. But back when AT still started founding osteopathy, there really wasn't a focus on preventative medicine with allopathic. And DOs call it allopathic. MDs don't call it allopathic. That's a DO term for the other people. But yes, that's actually very much things are, even MDs have a holistic approach. We like to say that we were the first ones to have that approach. Another thing that's kind of interesting is our state licensure exams are exactly the same for MD versus DO. Our residencies, right now there's a lot of change, but they're kind of merging the residencies. So the same residency programs that DOs are in, MDs are in, and it's kind of a vice versa. So there is very much the philosophy is kind of shared between the two. I would say now, though I think DOs have a habit to think more of the preventative side. And I mean, I've only gone to a DO school, so that's all I know. But
yeah, DOs absolutely think more holistically. Even still, with my experience and even knowing people who go to allopathic schools, that isn't a put down. It's just a difference. It's a very clear delineation. Now they, like Kyle said, we're both very similarly qualified, but if you think about the steps that you go through when you have any test to complete, first you do A, B, and C. We are taught in A, B, and C, and the way that we think, this is how you look at a patient, this is how you proceed next, A, B, C, this is what you do, and in those steps, we have a lot of training on who the patient is, what they do, how they, the very specific personal details of their life. Are they a carpenter? Are they using their hands a lot? Things like that. That would make it different than just saying, here, take some medication for the pain in your wrist. We can go ahead and look over the wrist, try to make some adjustments to their, their arms, hands. So I'm trying to give some specific examples. Hopefully that helps a little bit. So.
Another question here. So you would say that both MD and DO programs have similar curriculums and a similar product, but the more holistic approach is emphasized in a DO program?
Yeah, that sounds
very fair.
Very accurate. Yeah. I do know, specifically for our curriculum, we have an entire other class. So we have OMT, which focuses on anatomy. I've also been told that we take more hours in anatomy, more hours in dissection. But I think that kind of goes back to understanding structure and somatic dysfunction. So there's a little bit of extra stuff. I think
technically we actually have more schooling.
Yeah, there's more. We do have more schooling. We don't finish school until I think May 16th or something like that of this year. A lot of my friends that are at MD schools, they finish a little bit earlier because they don't take as much anatomy. So it's just another focus that we have.
Does that answer your question?
Yeah, good questions. Keep them coming.
Very good question.
Yeah. So we'll go ahead and move on with the presentation to the next slide if I can figure out how to get there. Again, technical issues. Give me a break. Okay. Let's talk a little bit more about KCOM specific medical program. As you can see, this is probably what it looks like as we sit currently. We are in the big round building at the very basement, just to let you know where we're at. So the student resources, what you get as a student here, and correct me if I'm wrong, okay? But there is an open door policy. A lot of these are cliches, so you can say that any medical school will give you an open door. Any school, really, a lot of schools say they have an open door policy. But I think here, knowing the faculty as I know them, it is a really a collaborative approach to the curriculum and to learning. So when in admissions, when we develop a class of 172 to start medical school, our goal is to be able to finish that 172. It's not a weeding out process at all. The faculty are very much on board with that. So they're here to help. We have 23 basic science faculty, 48 clinical faculty who all still work full-time in their fields, and a great, really, really good student affairs department of Wentz Hill.
Yeah, can I comment on that?
Yeah, absolutely.
So Kirksville is awesome, but Kirksville is maybe not the most bustling metropolis of scientific exploration, all that kind of stuff. I think ATS University does have research. There's professors that do research, but I think that most of them are here because of the teaching aspects. They have one-on-one. They come in the class and they teach us. Also, another thing that's kind of interesting is we have faculty that come from other places. So our nephrologist flew in from New Jersey. He was here for an entire week. Actually, he was from Las Vegas, wasn't he, actually? Endocrinologist. My point is that there's professors that come in from really all over the country that are very well known in their field. So we have a very diverse set of teachers as well that aren't just on campus but from all over the country.
But as far as the teaching and the open door policy, yes, that is a cliche saying, but the culture here is amazing. The culture here, I was, if I'm being completely frank with you guys who are looking to this kind of stuff, which is hopefully helpful, I was nervous that you'd go into a medical school and it would be a lot of, basically, super proper, and of course we're all very professional, but I mean, in other words, very unreachable people or faculty, and it has been wonderful. They're extremely professional, extremely bright and structured, and they are very helpful. The teachers are helpful, the students are helpful, and there is a real community and attitude of teamwork and helping the individual learn and get and understand.
Excellent. We're going to go ahead and take one question because they're coming in hot. So we'll take, for the students here, was the osteopathic philosophy a key factor in influencing your decision to attend ATSU?
Yeah, yes. I grew up in Missouri. There's a lot of DOs in Missouri. I've only ever had DO positions. I didn't really know the difference. But I very much am a whole person. I went to an undergrad that had a liberal arts education, and I really like that whole person idea. And I understand that other schools have that exact same philosophy. The MD schools have that as well. But for me, the DO philosophy, it resonated with me.
Do you want me to answer that?
Yeah.
Okay.
Yeah.
No, it was the deciding factor. It was the difference. It was the difference between allopathic and osteopathic. I came here and that was it for me. I'd never heard of a DO until I came to this school and just to tour it. And I came here, learned about it, and it was it. This is where I wanted to go, and this is where I am.
Excellent. Thank you. Good job. The next, we'll take one more question here before we move on, and this has a little background to it. I am a pharmacy tech, and I've witnessed a lot of narcotic abuse by patients. Seeing that abuse has steered me towards the DO route because I want to provide alternative options to patients besides medication for pain. Besides social issues that come along with narcotic abuse, what would be some medical problems associated with our narcotic abuse? So may I qualify that these guys are second-year students.
So you mean
I am not. What?
So is he referring to complications from medication use? Like, are we talking about adverse side effects, or are we talking about
From abuse, just any kind of long-term effects, possibly? And that's what I'm gathering. Is that what you're gathering?
Well,
Can you, Whitney? Can you expound upon that a little bit?
We can.
Yes, side effects and long-term effects of medical problems, and they're really numerous. They're huge. Would you not agree?
Oh yeah.
Yeah, we would have to. We only have an hour. It's really the answer to that question. Go ahead. It is a great question.
It is a good question. I mean, you have a lot of side effects. Obviously, you have social side effects, physical side effects. I mean, anything from literally slowing down your immune system, your lymphatic drainage. If you're talking about this, the very specific things that narcotics do, altering your mental status, can from causing intoxication while driving to leaving your children while unattended while you're doing drugs. I mean, if you're talking, there's a whole, gamut of things you can talk about. And it's really important, and it's a good question, and I'm glad you're asking it. And it's a neat motivation as well. Also, pharmacy is a great place to remember your drugs for school. So it's a good place to work.
Got a good head start.
It is a good head start. But
Excellent.
I think your motivation it sounds very osteopathic.
Yeah, so I mean, we actually just had narcotics. We just got done with neuro. I mean, narcotics are depressants. They're bad, and if you come off of them abruptly, that's bad too. Withdrawal is bad. I guess kind of through the osteopathic spin on it, DOs do have kind of that extra toolkit, the OMN, for pain relief. So it's just kind of cool. We do treatments for pain that maybe not other physicians might have. So that's kind of like the osteopathic spin on things. Like headaches, I know actually it's contraindicated to give some narcotics for some kind of headaches, but we know techniques that might help alleviate pain.
And there are people that will always need narcotics, and that's a great tool to have in your tool bag. But if you can eliminate that or slow that progression of them needing those things, or reduce the dependency, then why wouldn't we? So
That goes into that holistic approach that osteopathic medicine has in its approach to the patient. So is there another reason? Abuse always comes from another reason usually. Other than, there are many other reasons other than just psychological or depression factors. I mean, it may be a nutritional reason. So the osteopathic physician is well versed in looking for those other avenues rather than just treating, for what's Halidol or whatever giving another drug as a substitute is what I'm trying to say. So from a non-medical person, excuse my ignorance. But so anyway, thank you for the questions. These are great. Just keep them coming. Let's go back to a little bit about KCOM. We talked about the open door policy. As these two will attest, I'm sure, learning is a huge part of what we want you to master. And it sounds kind of stupid because it's a school, but how to learn is as much a part of your education as what you learn. And we have a whole department here at school that teaches you how to learn or can enhance your own learning styles. So what we encourage every student to do when they first come here is visit our learning resources department, because everybody has a learning style and a lot of people don't exactly know what that is, particularly when it comes to medical education. So they are well versed in allowing you to learn, to evaluate your learning style and then adapt what your specific learning style might be so that you can be a more effective learner and a much better medical student. We also have counseling services for those that, medical school is very stressful. There are other things outside in life that happen, and we are obviously going to be able to help in that regard as well. Here at KCOM, you can be as busy as you want to be. We have about right around 40 different student organizations that are with KCOM, and they involve academic resources, a lot of social activities that go on here. Every specialty in medicine has their own society, so there's a lot of different things to do outside of the classroom, just here at KCOM. We also have, these guys were referring to it before, our Student Advocate Association, which involves the entire family. So we have an organization specifically for spouses, partners, significant others, that they can be involved in the school and in the education as well. So we don't just, it's not the school, it's not the student versus the teacher, it's a whole family approach that we want to do here at KCOM. So we'll get more into the specifics, and these guys will be big helps with this. What do we use to learn here? What kind of tools do we have? Well, we have the old standby. We do still have lectures and laboratories throughout campus. A lot of diagnostic reasoning goes in. I'm not even sure what that means, to tell you the truth. But a lot of we are changing up a lot of the way you learn. So self-directed and small group learning has become a very important part of how we develop the curriculum. When I say we, I mean how the leadership in the administration are developing the curriculum. You will start patient encounters pretty much, your first week that you're here? Within the first 2 weeks that you're actually starting here on medical school, you will do standardized patient encounters. Standardized patients are patients that we get from the community, and we train them to respond to certain disorders, and then it's up to the student to find out or basically diagnose based on what the standardized patient is telling them. So they're just like a real patient, only taught, trained. A lot of electronic forums. The students use iPads. We've got great human patient simulators. They also use laptops. You got both, right? Yeah. Some software works better on iPads than it does laptops, so they utilize both modalities. Any elaboration? Okay, again, we are. Anyway, the clinical skills are a huge focus here at KCOM. We want you to be competent clinicians. That's our one of our largest goals when we graduate you as a physician. So we're going to use, again, those standardized patients, the human patient simulators. We have 15 of those. I think that's more than any, not only DO school, but I think that's more than most medical schools in the country have as far as a laboratory. They just rebuilt the lab over the last couple of years, and it's amazing. If you ever have a chance to come to the Kirksville campus, please check out the Human Patient Simulator Lab. Lisa Archer will be a great tour guide for you. Palpatory skills are a huge part of the clinical studies. And again, another show-off feature is the OTM lab, or theater. I guess they call it, it's not even a lab, it's a theater, yeah, that you should come check out. Of course, we're going to verse you in surgical competency skills, principles of medicine lab, which you get pretty much throughout your education, and then of course pharmacology, which we've already addressed, and infectious disease skills within the labs, utilizing those standardized patients and human patient simulators. Highlights of the curriculum. We brushed on the course, the complete DO, or the complete doctor course. Do you guys want to take this one? Kind of elaborate on what that is?
Yeah, so the complete doctor course, actually, I think it's a little bit funny. So our complete doctor course, or DO course, is actually taught by an ND, Dr. Ryle, Wes Ryle. But that's basically all your clinical, your skill stuff. So we have Codo Lab, in which we look into each other's ears, listen to each other's hearts, all the things that we typically think of doctors doing. And it's cool because we get to integrate the clinical physical assessments with all the basic sciences that we're learning at that time. So during pulmonology, we're learning about VO2 and lung pressures. We're also listening to the lungs. So it's kind of a way to tie both clinical and basic sciences.
It's a great way to integrate what we're learning, from a scientific, from a scientific perspective to, you walk into a clinic and you see a patient and now what? So it's a great integration. Also, something else that we get to do, as it says on the PowerPoint, is that we get to do the school physicals. So there's, thousands of, of school-age children here, and they divide us up, and we see the high school, middle school, and the young children as well, and just kind of do a brief screening for all of them. And it's a wonderful experience, an absolutely wonderful experience, and you get to really start to use those skills. I mean, when you go through, 20 kids in a few minutes, you start to really understand what things are supposed to look like and sound like. So, great experience.
Good. After your first year, because the first year is a very difficult year academically, it's the sheer volume of information that you'll get as a student, you will go off on a 2-week externship where you go off into another doctor's office and follow them around for a couple weeks.
Right.
And get a medicine back into your system, really, just to give you the idea that yeah, this is, again, what you want to do. I think it's a great idea. I don't know any other school that does something like that, so it's pretty neat. That's not very well. Anyway, sorry for the alignment. But anyway, there's a lot of different tools that we'll use. Our ultrasound lab that we've got here at KCOM is second to none. We just recently purchased more. I think we have, 25 units, something of that nature. And they use ultrasound for diagnosis now. It used to be a therapeutic tool when I was going through school, but it's now for diagnosis. And they couple that ultrasound lab with everything you do in OMT, everything you do in the anatomy lab.
Yes, it's all kind of correlated. So, when we have the, comment, when we're learning about lungs and pressures in lungs, things like that, then we can go to the ultrasound lab and literally learn how to see a pleural effusion, which would be the, the waterish type stuff that would be on lungs when you're really super sick. So you can learn to see different types of pathology and things like that in the ultrasound lab. Other medical schools I know don't have as much experience with that. So we literally have, our 3rd and 4th years that go out on these rotations, and they'll have the brand new residents just learning these things when the students are like, oh, here, I got that. They know how exactly to do it. It's pretty fast, pretty neat.
Yeah, very good.
Good, good. We have a question that is just perfectly timed. Testing at ATSU is done block style, correct?
Yes.
Voila.
Cool.
Because we do, well, that's just what we're getting into right now. So go ahead if you can.
Yeah, so block style. So we have, it's all integrated, it's all system based. So we just got done with neuro. So we had neurology 1 and neurology 2 blocks. Typically they're going to be 3 or 4 weeks long. And in that one test, we have biochemistry, physiology, kind of a clinical based class. So for neurology, it was taught by a neurologist, pathology, sometimes there's histology. And so all those things, and pharmacology is another one, are all kind of integrated, and we have all the questions randomized. And so we test all those things the same morning, which is really nice because that's how your boards will be. Your boards will be all random, mixed kind of a testing environment.
So this block style was adopted probably 4 or 5 years ago, and immediate difference in the pass rate for boards went up like 2 to 3%, which it was already 90-some%. Now it's up to the upper 90s percentile. So to see that difference just from one little change in the curriculum was pretty significant. So the students don't like the block exams so much because they're not easy. But you know what? It pays off in the end because their board scores have gone up significantally.
And we don't know any different, really.
Yeah,
So.
yeah, that's true.
Plus, when you're done with the test, then you know, like you're done. Like you don't have a test like the next day typically. So,
Yeah.
Yeah. Excellent. Good question. Thanks for the transition. So now this is basically the next slide here is basically reiterating what we said. So the classes are in blocks as well. The blocks will be anywhere from 3 to 7 weeks long, depending on the topic. And again, you can see up above it says patient-centered, systems-based curriculum. So systems-based means that it's going to be like cardiovascular system. You'll learn everything having to do with cardiovascular, anatomy, physiology, biochemistry, all within that block system. And then they're going to, with the OMT treatment, with the manipulation, with the ultrasound diagnostic, with the human patient simulators, that's where we're going to look at it, utilize that, and collaboratively relate that to the patient. So to give you an instance, medical school used to be you would take a biochemistry course, and then 2 years later you would go on rotation. You never really knew how the biochemistry fit in to the whole entire system. Well, with the systems-based patient-centered curriculum, you get to understand how those basic sciences are now a huge, huge part of the overall health and treatment of this patient.
I couldn't imagine doing it any other way.
Yeah,
It is.
yeah. It's the way medical education has become, thank God.
Yeah.
So yeah, like I said, when I went to school, it was all basic sciences first 2 years and clinical sciences the second 2 years, and you never knew how the two met.
Right.
So So our faculty themselves are very active in other things, not just teaching. We have a lot of faculty that are involved in societies of medical educators, National Academy of Osteopathic Medical Educators. So they're very active in the curriculum development of doing things like this block style curriculum, this systems-based curriculum. So these are kind of the pioneers, the people that really are on the cutting edge, if you will allow me to use a cliche, of medical education, so they adopt it as quickly as they can in KCOM, and that's not an easy task. Believe me, I've seen that.
Can you mind if I add something?
Oh, please do.
So in the classroom, I love it because even since I've been here with it 2 years, I see that even our teachers, our lecturers, are always trying to improve the way we learn. They even bring things into the classroom like a survey. What are they, like a lecture type tool system where you can type in what you think the answer is, and they quiz you a couple questions all throughout the lecture as they teach, and then they go back and reiterate. And so it's an excellent way to learn. So they are incorporating all of these proven methods for how you learn into the classroom and really help us to retain and keep important information relevant.
Yeah. Good. Excellent. So just to give you kind of a generalized idea of how these guys are assessed or how they're tested. We use a lot of different testing techniques, as they sit or snicker behind me. So yes, they use classroom exams, which are pretty standard. Case presentations are a newer thing in medical education. Standardized patient assessment. So they're tested on how they interact with those standardized patients. And again, the standardized patients are trained on how to assess that. So talk about nerve-wracking your first time.
Right.
Can you imagine?
Right. The patients are really good at it too.
Yeah.
The standardized.
Yeah, they're trained well. OMS 1 and 2 testing, anatomy labs, and you can see the rest. We have OTM practical exams. Again, we talked about the block exams. And a very important question that a lot of students ask about is board prep. Do you guys want to, since you're there or almost there?
Yes. Yeah, so with part of the tuition, I guess we have access to Kaplan, which I'm sure everyone knows about Kaplan. They're the leading test preparer. So there's a Kaplan for step 1 for complex, or level 1, actually, is how they call it, level 1 for complex. There's also the school offer, through our tuition, we buy com banks and question banks and learning resources. So we mentioned them earlier. Learning resources will sit down with you and kind of plan out a schedule for you to take your boards and what you should be doing in order to prepare for that.
Excellent.
Yeah.
Good. Good. Very good. And there are 3 steps to the exam?
Yes. The first, so you take level 2 or level 1 after your second year. By and far, that is the most important one. That's what determines what kind of doctor you can be. And it's interesting because that one's based primarily off of your basic sciences that you learn your first 2 years. There's also level 2 and level 3 that you take your 3rd and 4th year. And those are good, and you need to pass them, but the main deciding factor actually comes back to your level 1, which is dependent upon your understanding of basic sciences.
Good.
Oh, the other thing I was going to add about that, so the COMLEX is the DO version, the USMLE is the MD version. DOs can take both, and that way they can apply to both MD and historically DO residencies. Kind of have a clean slate or a level playing field, which is kind of interesting, and some students decide to do that.
Okay, great, thank you. So when you go off in your 3rd and 4th years in med school, you will go off into rotations. So those rotations are in clinics. Most of the time they're in hospitals. With KCOM, those rotations are basically from East Coast to West Coast. We have a lot of them here in Missouri. And from whence I hail, there's a few in right around the Phoenix, Arizona area. You can see we have some in Utah, Illinois, Michigan, Ohio, Pennsylvania, New Jersey. So they're basically spread all across the country, and for those 3rd and 4th years. So you'll be based out of, one hospital. So in those 3rd year rotations, you can see the list of rotations that you'll have. You'll do specialty rotations throughout those. Throughout your 3rd year, and those are usually a month or so.
4 weeks.
4 weeks rotations.
Some are 2.
And then and then you'll and then you'll have a few electives at the end in case you're thinking about any specializations or anything like that you might want. 4th year, you will continue on some of those rotations again, get a little bit more specific, and you can see we have even more available rotations: psychiatry, neurology, pediatric selective rotations. But the biggest thing you'll see in the 4th year is your electives are, you're allowed a lot more electives. So what the students will do here is what they do, they're called audition rotations. So when they're getting ready to go to a residency, they can use these rotations as kind of a dip their toe in the water for that residency, and that's why it's called an audition rotation. So they can see if they like the residency, and also the residency can see if they like the students. So you're allowed a lot more freedom of movement within that 4th year elective. Right? Okay. Okay. So here at KCOM, DO sometimes has a reputation of only being primary care, only being restricted in their residencies or in their specialties that the students go through. Well, we wanted to just basically show you that residencies are open to any kind of DO student. KCOM has people that has physicians that go into all different types of specialties, even the competitive ones. Orthopedic surgery, you can see. Dermatology, we have a great dermatology rotation in residency. around here. Emergency med is a common.
Dr. Cleaver.
We're in
Dr.
dermatology.
Cleaver, yeah.
If we're in dermatology right now.
Okay.
so.
Okay. Emergency medicine is a fun one and a very common residency and rotation that DOs love to do. Anesthesiology is another very competitive one. So you can see the list of residencies goes on and on and on. We have a graduate, she's now a graduate, but she's in a pediatric oncology that specializes in brain and spinal cord tumors out in Ohio. I think she's at the, is it Cleveland Clinic or something? Yeah. So you can see your residencies, and you're limited only by your own desire to see what kind of residency you want to go into.
I was going to say, I think a lot of times people will imagine DOs as being primary care physicians, and that is true. But I think it's because the people that apply and pursue DO schools are more likely to want the holistic, want to do family medicine, want to see the whole family, want to see kids until they're adults. I think it's the people that apply versus the opportunities afterwards. Though the majority of DOs, I think, end up in primary care, so pediatrics, family medicine, stuff like that. Yeah.
That's exactly right. It goes back to our roots. A.T. Still himself was a man that treated anybody regardless of ability to pay. And I think a lot of DOs have that mindset in them. So he took chickens. If they didn't have a ride back to their farm, he would make sure that they got one or give them the money to do that. So that's why people were coming from all over the place, because he treated anybody for any reason, and he helped a great percentage of them. So that mindset has really carried over, and that attitude is carried over into osteopathic medicine. So yeah, it's not on purpose, but we do have primary care. You can see the residency matches the majority, a little over the majority of our students go into primary care residencies. So most of those are emergency medicine, internal medicine, and family medicine, as you can tell. So as Kyle mentioned, there are matches up in the upper left corner. Our students match in, the majority of those are osteopathic residencies. Most of those are allopathic residencies, and we have a great military presence here at KCOM as well. So they do the residencies right within the military there.
Yeah, and I'm an Army HPSB recipient. So if there's any question on that, I could talk further about that.
Definitely. Got a question come up. What specialties are you guys considering? Well, I'm no. So you guys go ahead.
Yeah. Ask me in a month, I might change. I like everything in medicine. Recently I like internal medicine and maybe emergency med, but I don't know. Everything is exciting to me. Everything seems interesting. So I'm not exactly sure, but internal medicine, emergency med, or surgery.
That's where I'm at too. Everywhere, each clinic I go into, I'm like, oh, this is so great. So I'm sure at some point I'll land on something, but I'm not really sure. The only thing I know I don't want to do is pediatrics, because I get plenty of that at home.
The old saying, that's what rotations are for, right?
Right.
Yeah,
right.
Very good. Good question. Okay, I covered that. Good. So we're winding down the curricular portion, but obviously, Kirksville College of Osteopathic Medicine is here in Kirksville, Missouri. Some of you are here with us in Kirksville, most of you are throughout the state. Kirksville is a small town in northeast Missouri, which makes it a great place to be a student, because there's very few distractions, but you can be as busy as you want to be. Kirksville itself is a great town. It's very historic. We have a Civil War battle that took place just right down the block here that they celebrate every year. We have a state park that's got a great lake and trails and a restaurant, and you can rent boats. So there's a lot of activities to do in the summer and the winter time. The summer is full of festivals. The nice thing about a small town and a college in a small town, it is very, very safe. We get a report every year from the criminal statistics, and consistently it is 0.0000000. So, which is great, because our campus is basically open 24/7 so students can study. So they feel very safe. I hope you guys do. Yeah. When you are going around. We have a hospital right next door, which is a regional hospital. It's the #1 hospital in northern Missouri. So it's got a great staff associated with that. The students have various activities within that hospital. There's also rotations. If you want to do a residency within that hospital, you can do that as well. Farmers market we do because we're an agricultural town. We have an undergraduate school right next door at Truman State, from whence Michaela hails, and affordable housing. This is a small town, so housing doesn't cost much. Now, when you're on campus here, you can see the people playing basketball. That's our Thompson Campus Center. It's our gym, basically, but it's much more than that to us. You will get a membership, or you're allowed to use that, as well as your significant other can utilize that. And the aquatic center here in town that you can also use if you're a swimmer. So there's lots of different activities that you can do through the Thompson Campus Center, including intramurals, which is listed right there. So what we really want to talk about, or end up dealing with or talking about today, is our Still Scholars Early Acceptance Program. Okay, so basically what a Still Scholar is somebody that really has dedicated the idea that they want to attend KCOM. So it's kind of they call it early acceptance, but it's really a spearheaded track to attend the Kirksville College of Osteopathic Medicine. So that program is really for that mission. So we're trying to find students like these that are really highly competent, highly qualified, as they are trying to find us. So we're trying to, Still Scholars helps us make a match with students. So it gives us the ability to find, again, highly capable students who are dedicated to osteopathic medicine and osteopathic philosophy. The biggest thing it allows students, this program allows students to really focus more on the undergraduate experience. When you have an idea, when you're pretty set on going to one school, then you don't have to worry about the application process to various schools, the interview process, the expense of the interview process of travel. And so that's what the Still Scholars allows a lot of people to do. Also, the nice perk with the Still Scholars program is we waive the MCAT requirement for the program. So we have 2 Still Scholars recipients, or people that were involved in Still Scholars, so we'll get their feedback. We'll kind of go through some qualifications here first. So again, you will sign an agreement that does state that you are exclusively interested in KCOM as an osteopathic medical school. There are some GPA minimums. You can see we have to maintain a 3.4 and B average, B plus average, while you're going through undergraduate school. Their shadowing, service learning, and leadership experiences are all very, very important to make you a well-rounded applicant. So the holistic attitude of osteopathic medicine not only is within school, but it is within our admissions and our admissions philosophies as well. So we want you to be a well-rounded person in order to be a competent, or competitive, I should say, applicant for the Still Scholars program and for KCOM. So there's a course you'll take in Blackboard, which is our learning resource management system that you'll use. You'll do discussion programs. You'll do a book report. You'll read a book and do a book discussion, not necessarily a report, during that course. And then also meeting different deadlines throughout the application process is also very important in maintaining the requirements for the program. Okay. So as you undergrads are doing, keep it up. Your second year, you will apply to the ACOMAS application. That's the centralized application for osteopathic medicine. So as I said, a centralized application, which you will designate KCOM as the school. And then once you complete that, you'll receive a secondary application from us, and basically let that go through the review the process of getting that completed and reviewed as you continue to go through your shadowing and service and leadership programs. So there is an interview. We'll do the first specific interview day for final acceptance into med school. It is a specific interview day, for Still Scholars. So that's only Still Scholars come for that day, and so therefore all the faculty interviewers know that. We generally do that in the last weekend in September. So anything to elaborate yet?
I can give my story, but
yeah,
keep going.
I think we're almost through that. So once you're accepted and you meet all those criteria that we talked about, the 3.4 GPA, the continuing of the leadership experiences and shadowing experiences, the completed application, all of those things that we talked about before, a great pre-matriculation interview with the faculty, it takes about 3 weeks for you to be notified that you are accepted. So that's an early acceptance. So yeah, I wanted to definitely have these two go through their experience, not only as from an undergraduate to medical school, but their experience as still scholars. So please elaborate, and I'll continue to take questions here.
Okay, so I went to Westminster College in Fulton, Missouri, and at the time there was no matriculation agreement between Westminster and ATSU. There is now, and I know they're expanding. So there's and really, I think if you apply, if you know about it, and you apply, you work with the school. I don't think there has to be a specific matriculation agreement. That there is something like that. I don't know anything else about that. Matriculation agreements or anything like that.
Well, what happens is the schools, we used to have it where we'd only have still scholars with the schools, but we've expanded upon that a little bit. So if you want to be a still scholar, no matter what school you're going to, you still can go through the application process.
There we go. Okay.
Yeah, we explained that.
Yeah. And so I wanted to be a DO. I've only ever had DO positions for my physicians. So I was looking at Michigan State, which is a DO school. I was looking at ATSU. And I'm from Missouri, so ATSU kind of, and it's the founding, the flagship of osteopathy. And so after my second year, I had a really good first year of undergrad, really good second year. My GPA was great. I had all the extracurriculars. I was doing everything that ATSU was looking for in a candidate. And so at the end of my sophomore year, I applied. We had an interview that fall. And so I think there was probably 20, 25 of us, something like that had interviews. And then I was accepted into the Still Scholar program. And so then over the course of the next year, I continued to do well in classes, continued to do extracurricular activities, shadowed, and actually at our time, it was through Facebook, of all things, was our book discussion. And so we discussed on a weekly basis this book we're reading, The Secret Life, or was it about HeLa cells, Secret Life of Henrietta Lacks? Immortal Life of Henrietta Lacks. And so it was a clinical-based book about this science dilemma, these HeLa cells that they use in research. And so then we did all that, and then we, like it says, and then the school walked you through it. So then we applied to the COMIS, and then we applied as our secondary to ATSU. And so something about that is you have to sign something when you get accepted to the Still Scholar program at the beginning of your junior year, that you're kind of set with ATSU. You're not going to apply to other schools. Yeah, and so I think it was like a first-round draft pick. We were first-round draft picks for ATSU.
Absolutely.
And so it was really great because I didn't have to take the MCAT. So between my junior and senior year, where most people, other people that were studying for the MCAT, I went to Belize as a medical mission trip, and it was great. The one thing I have to warn people about, if you're considering the HPSB scholarship, they're kind of iffy on if they need you to have even if you're accepted to medical school, they might still want you to have an MCAT. And so I went back and forth about taking it. I ended up taking a practice test at Mizzou. At the very last moment, they said, "Hey, you're fine. Your undergrad grades are great. Your they went back to my ACT. They're like, your ACT from high school is great. You don't have to take the MCAT." That's something to consider if you're considering a medical or military route, which they pay for medical school and they give you $20,000 and all that kind of stuff. And now I'm here and everything's great.
Okay, so I don't really want to bore you guys tons with the story of my specifics, but what I do want to mention is that I'm sure that listening to this it might be a little bit overwhelming. You might have a lot of questions and things like that. But the staff, the staff here is amazing. So any questions that you guys have, talk to them. And as far as how my decision to come, I love it here. This is the only place I ever looked at. I want to offer some words of encouragement. I'm a non-traditional student that decided to go back to school. I have 4 children, and I decided to go back to school after I had all my kids. I had them young and decided that that's what I wanted to do. And it's, they're incredibly supportive here of family and the non-traditional students. And it's a lot of work, but I went back to undergrad, got good grades, and found out about here, and it's like, and I love it. So if you guys are considering medical schools you're considering here, there's nowhere I could redo and have this be any better. Of course, there's a lot of hard work involved, but anything worth having is. And I've had a blast with my classmates, with the staff, and the admissions staff is so incredibly helpful and so incredibly knowledgeable. So even if you want them to sit down with you and look over your, personal statements, anything like that, they'll do that for you. I guess I just want to encourage you guys to keep doing whatever you're doing. And if you want to be in healthcare, just keep getting experience and, putting your foot in the door and seeing the things that you like, the things that you love to do. And if that's what you love, just keep trying and keep doing it, and it'll all be just fine in the end. I know it sounds silly, but I am a total believer that if you work hard, that you'll land in your life exactly where you're supposed to.
Very good. Very good. Well, you see there on your screen, you have some contact information for us here at admissions, and thank you for all the kind words.
Absolutely.
That was very nice. Well, from an administrator side, we truly love our students. We're not going to get emotional here.
We're already accepted. We didn't have to.
Oh, okay. Then forget it. No,
we didn't have to. They're genuine.
Yeah, they are genuine because we do love our students here at KCOM. So contact Andrea. I'm obviously not Andrea. I'm here in place of her today. So please let us know if you have any questions. There's her email address. Does anybody have any last minute questions here? It's getting right at 8 o'clock, so we don't want to keep you any longer than we need to. So I'll stay for a couple more minutes and answer any questions that you all might have. But if there are none, then we will thank you for attending this meeting today, and thank you too for your help.
Thank you for having us.
We appreciate it. And other than that, I think we're done.
Great.
Great.
Good luck.
Yeah, good luck.